news is sexually transmitted infection, as well known as STIs. STIs is an infection that are commonly spread by sexual intercourse. Each year, there is estimated 357 million new infections with one of four STIs, includes chlamydia, gonorrhea, syphilis, and trichomoniasis. More than 500 million people are estimated to have genital infection with herpes simplex virus, or we could call HSV. More than 290 million women have a HPV infection. Over 900,000 pregnant women were infected with syphilis, resulting in approximately 350,000 adverse birth outcomes, including stillbirth in 2012. In some cases, STIs can have serious reproductive health consequences beyond the immediate impact of the infection itself. But STIs can be curable and has many methods to prevent and treat the STIs infection. To prevent from STIs affect the world is through counseling and behavioral approaches and various methods. Counseling and behavioral interventions offer primary prevention against STIs, as well as against unintended pregnancy. In addition, counseling can improve people's ability to recognize the symptoms of STIs and increase the likelihood they will seek care or encourage a sexual partner to do so. Effective treatment is currently available for 3 bacterial STIs, chlamydia, gonorrhea, and syphilis, and 1 parasitic STI, trichomoniasis, are generally curable with existing. Effective single-dose regimens of antibiotics, the most effective medication available for herpes and HIV, are antivirals that can modulate the cause of the disease but cannot cure the disease. Safe and highly effective vaccines are available for 2 STIs, such as hepatitis B and HPV. HPV vaccines could prevent the death of more than 4 million women over the next decade in low and middle income countries where more cases of cervical cancer occur. If 70% vaccination coverage can be achieved. Despite considerable efforts to identify simple interventions that can reduce risky sexual behavior, behavior change remains a complex challenge. Researchers has demonstrated the need to focus on carefully defined populations, consult extensively with the identified target population, and involve them in design, implementation, and evaluation. World Health Organization (WHO) develops global norms and standards for STI treatment and prevention, strengthened system for surveillance and monitoring, including those for drug-resistant gonorrhea, and leads the setting of the global research agenda on STIs, in particular gonorrhea, to antibiotics has increased rapidly in recent years and has reduced treatment options. Low and middle income countries rely on identifying consistent, easily recognizable signs and systems to guide treatment without the use of laboratory tests. This is called syndromic management. This approach, which often relies on clinical algorithms, allows health workers to diagnose specific infection on the basis of observed syndromes, examples: vaginal discharge, urethral discharge, genital ulcers, and abdominal pain. Syndromic management is simple and assure rapid same-day treatment and avoids expensive or unavailable diagnostics tests. However, this approach misses infections that do not demonstrate any syndromes, the majority of STIs globally. That's all for today. I'm Izzy Najwa from Health News, and have a good day.